This is my presentation on lung cancer by Becky Rose. The lungs are the main organs of respiration and facilitate in the exchange of oxygen and carbon dioxide. Lung cancer is characterized by abnormal, uncontrolled growth of cells in the lung tissues. They begin to grow out of control instead of dying like they are scheduled to in a normal cell cycle. Lung cancer is detected in both men and women and is considered to be the second most common diagnosis of cancer. Lung cancer is the most common cause of death related to cancer as well. In 2008, the World Health Organization contributes 7.6 million deaths worldwide from cancer, and 1.37 million of those are reported to be from lung cancer. There are two types of lung cancer. You have non-small cell carcinomas and small cell carcinomas. Your non-small cell carcinomas include your squamous cell carcinomas, adenocarcinoma, and large cell carcinoma. Signs and symptoms of lung cancer is a cough that does not go away, chest pain that worsens with deep breathing, hoarseness, weight loss, decrease in appetite, shortness of breath, and fatigue. The association between lung cancer and cigarettes is by far the most documented risk factor that has been found. Smokers have a 20% higher risk of developing lung cancer. Most cancers require a number of different treatments, including surgery, chemotherapy, or radiation therapy. Not all of these options are available depending on the severity of your disease. Sometimes a combination of these may be required for treatment. Many of the side effects associated with treatment are oftentimes more taxing and severe on the body than the actual disease. Side effects include hair loss, mouth sores, nausea, vomiting, diarrhea or constipation, increased risk of bleeding, infections, and fatigue. Depending on the course of treatment you and your doctor decide to proceed with, chemotherapy may be involved. Many of the chemotherapeutic agents on the market are extremely toxic and have both short-term and long-term side effects. Typically, 4 to 6 cycles of chemotherapy are required, and often these patients are hospitalized for 3 to 4 weeks at a time with each cycle of chemo administered. Care such as hospice is an option that is also available to these patients. This care switches the focus from active treatment for a cure to treatment for patient comfort. This is done to improve the quality over quantity of life for patients that are terminally ill. Many patients will live longer with palliative care due to the decrease of strain on their bodies. But who gets to decide when a patient is faced with these tough decisions? Do doctors have the right to continue to treat a patient up until their actual death? And is that not considered to be cruel? Why can assisted suicide not be offered to those with impending deaths? And why can people not choose dignity over the horrifying deaths that often accompany cancer? Dr. Kevorkian was criticized for his treatment of dying patients in the early 1990s. While I do not necessarily agree with his approach, I do, however, feel that the concept he was trying to get across was and is still necessary in healthcare. He was very much a radical, but his patients were not made to suffer from long, extensive illnesses or courses of treatment. As members of the healthcare team, we have all taken the oath to do no harm, but that does not seem to apply with terminally ill patients. Doctors often forget that while saving a patient's life, they are inflicting horrible pain and suffering on both the patient and their family. This suffering can be short-term, but it may also be long-term side effects of their treatment. Giving false hope to a patient is not only ethically wrong, but it sometimes draws out a process that is inevitable in the end. Now there are a few states that are supporting physician-assisted suicide, including Montana, Washington, and Oregon. If a patient is faced with imminent death, then maintaining some control over the last days of their lives makes the dying process easier. Despite the technology and medications available, oftentimes patients simply have a need to die with dignity. Everyone deserves the right to a peaceful passing, and when healing and relief are no longer options, we should all advocate for that peace for our loved ones.